sticker shock. It might be the worst combination of words in the English language. Like, who actually enjoys a sticker shock? I can't think of a single situation or a single person where those words are good, especially when it comes to medical bills. I'm going to give you one strategy today that you can use to help avoid those big medical bills that would cause you sticker shock in this episode of Healthcare Hacks. Hi, my name is John. I'm your healthcare hacker and a sticker shock avoider. Before I get started today, please take a minute, like this video, subscribe to our channel, and follow us on whatever your favorite platform of social media is. That way you can stay up to date with our content and our healthcare hacks and ways to navigate this complex U.S. healthcare system. Today, I'm going to talk about what you can do before you receive care to make sure you don't end up with a large unexpected bill. Specifically, we're going to talk about prior authorizations, what they are, when they apply, and what you can do to avoid the consequences of not having one. So first, what are prior authorizations? Prior authorizations go by several terminology. You might hear them pre-authorizations, prior approvals. Basically, it's where your doctor requests a service to be done to your insurance company to make sure it's going to be covered. They'll say, as one example, let's say you have to have back surgery, you've had a bad back. The health plan has a policy that says to have back surgery, you need to meet these criteria. One might be you need 6 weeks of conservative treatment, like a chiropractor or physical therapy. Well, if your provider can prove that you've done that and you meet the criteria, then that procedure will be approved. If you haven't done it, then that procedure is going to be denied. So the prior approval is just the way your insurance company can make sure that you met the criteria before the service is done, before the procedure is done, so that they will cover it after it's done. Prior authorizations don't apply to everything. There's only certain circumstances where they apply, and it really depends on your health plan. So what I'm going to tell you is kind of generic, and you really need to look in your health plan details for specifics about your coverage and what you need a prior authorization for and what you don't. But most times when you go to the doctor's office because you're sick or just a routine checkup or follow-up, you don't need a prior authorization for this. Also, if you have an emergency, you don't need a prior authorization. It's an emergency. They'll do whatever services and they'll be covered, all things considered. Where you do need prior authorizations is for procedures that are planned in advance. These can be surgeries or high-dollar radiology procedures like MRIs and CTs in particular. In those cases, you have to get approval from your insurance company before, or your doctor does, or the hospital does, before you have the service, or else it won't be covered. And that can lead to a large liability that either the doctor and hospital have to kind of eat, or you're going to get a large bill in the mail. There's one strategy I use personally, and I recommend people use, to make sure you don't get a situation where an authorization is required and you don't get one. And that's to simply ask if you're having an outpatient surgery or any sort of very expensive outpatient procedure, so an MRI, a CT, a sleep study, I can't make a list, but anything that seems to be very expensive and involved, ask your doctor, ask the person scheduling your test if a prior authorization is required by your health plan. They will check. It's up to them. You don't technically have to do anything. They will check and see if it's required. If you want to play it safe, ask the person what the procedure code is you're going to have done, the surgery or the radiology test, and then call your health plan and give them that procedure code and ask if a prior authorization is required. That way you can be sure that either they have one or that one's not necessary. Because again, different health plans have different rules. So, I rely on the system to look into it and then just double check if I'm really concerned about my procedure being covered. This is really important. I've seen too many people get stuck with large bills because they don't go through this simple step. They don't ask their doctor isn't willing, or their hospital isn't willing to get a prior authorization. You should always ask, and if the organization is not willing, I question why, and maybe consider going somewhere else. Because at the end of the day, that should be part of what they do. They have your medical records. They're the ones that can prove that you require this test or this test is appropriate. So rely on them, and 99.9% of times they'll do it and they will do it right. Well, that's just one piece of advice of how to avoid a large hospital or healthcare bill. In future episodes, we're going to go into more details about other ways you can avoid bills. But in the meantime, if you have any questions or comments about this episode, please leave them below and we'll try to address them in a future episode of Healthcare Hacks. And as always, make sure you get the facts by joining me in the next episode of Healthcare Hacks.